Imagine this. You or your loved one is rushed to the hospital critically ill. Nurses are running from patient to patient, doing their best. But there simply aren't enough of them. It's not their fault, it's a systematic issue. Today I'm going to speak about safe staffing and why this is an important issue that needs to be addressed. Safe staffing, which means mandating minimum nurse-to-patient ratios, is critical for patient safety and nurse well-being. Yet many hospitals lack these policies. Today I'll show you why safe staffing saves lives and why it's time for this to become a nationwide standard. Safe staffing is often debated. Hospital administrators worry about costs and staffing flexibility. They argue that hiring more nurses could strain budgets. But research tells a different story. Hospitals with safe staffing have 14% lower mortality rates, according to the New York State Nurses Association. Without enough nurses, patient outcomes suffer. There are more infections, errors, and even preventable deaths. This isn't just a cost issue, it's a matter of life and death. This is why I strongly support policies that enforce safe staffing ratios. Here's why. First, patient safety improves dramatically with better staffing. A study from the Department for Professional Employees highlights that adequate nurse staffing prevents complications like infections, medication errors, and falls. Patients are less likely to die when nurses can give each patient the attention they deserve. Second, nurses stay in the profession longer when their workloads are manageable. Currently, burnout is driving nurses out of hospitals at alarming rates. Nurses who care for too many patients at once report higher stress levels, which increases turnover. High turnover then leads to even worse staffing shortages, creating a vicious cycle. And third, safe staffing saves hospitals money. While it may seem expensive to hire more nurses up front, reducing nurse turnover saves millions in recruitment and training costs. Hospitals that retain their nurses also provide higher quality care, which avoids cost readmissions and legal settlements for medical errors. Critics may argue that flexible staffing models, where hospitals adjust staffing levels based on daily patient counts, are sufficient. But the reality is that without enforceable ratios, cost cutting often takes priority over patient care, leaving nurses overwhelmed and patients at risk. Now, to those who may be skeptical of this approach, I understand the hesitation. Implementing safe staffing ratios requires an initial investment, and change is never easy. But we have evidence from states like California, where safe staffing laws have been in place for years. California hospitals report better patient outcomes, improved nurse satisfaction, and even lower costs from reduced turnover. We all want the same thing: safe, high-quality care for every patient and sustainability. A supportive environment for healthcare workers, and better patient outcomes. It's time to take actions. Support legislation that mandates safe staffing ratios. Advocate for policies that ensure every nurse has the time, resources, and team they need to provide the best possible care. Safe staffing isn't just a policy, it's a promise that no patient will ever be neglected and no nurse will ever have to choose between exhaustion and excellence. In closing, I'll leave you with this. Safe staffing saves lives, protects nurses, and benefits everyone: patients, providers, and even hospital budgets. Every patient deserves the best care, and every nurse deserves the support to deliver it. Let's work together to make safe staffing the standard nationwide, because healthcare isn't just about cost, it's about people, and people deserve better.